let's now move on to the vaccine since you opened the discussion on that one. The vaccines now available, although it is not yet enough, of course, and most working from home, unfortunately, belong to the, we call that the B6 classification, which is actually the last priority. Some companies also offer vaccines to employees, but there's still hesitancy, right, of being inoculated for various reasons.
Yes.
They prefer different
Yeah.
brands or talagang
Mm.
ayaw lang nila, no, trust and being
Yeah.
comfortable with.
Oh,
What is the cause of this hesitancy, doctor? And what is the best strategy to actually
okay.
encourage the people to be vaccinated?
Alam mo, if I were there pa, I would I would actually coach them on the following. Kasi ang customer service kaya time is survey kasi para malaman natin ang pulse of the entire country.
Hmm.
Ang number one concern of the people is safety. You look at the data. And then, of course, efficacy. So dapat yun ang unang-una eh. I give medications. Basically, effective ba yan? And then safe ba yan? And then the quality.
Hmm.
Importante yung ESQ when you give medications eh. Kasi kung hindi gumaling yung pasyente at hindi safe, wala kang pasyente. That's the reason why some doctors are not successful because, or some people, or even not only doctors, it's because the trust that is actually given to the doctors eh. And the trust would mean giving efficacious, safe, and quality products. Now, if you have working in the corporate world before, alam naman natin na the number one company in the world is Pfizer. So, we dropped the ball, according to Secretary Teddy Boy Locsin, kasi we should have gotten 10 million doses
Yeah.
last July. So, anong nangyari nun? Hindi natin nakuha yon.
Hmm.
We should have started January and then the herd immunity makukuha natin.
Hmm.
Plus, so we have to have multiple choices. Kaya lang, dapat the best vaccines, kinuha na natin kagad yun eh. And at that time, Pfizer, Moderna, Astra, dapat naglagay na tayo doon kagad sa phase 3 kasi alam natin lalabas yun ng December. Right? So nakuha na
Right.
natin yun. So we did not queue up early enough eh. So late na tayo nag-queue up eh. That's the first one. Number 2, sorry for being so transparent about this. But the
Sure, we need your
government's
candidness.
the government's preference for the Chinese vaccine, not I'm saying that they're not effective, no. Yun ang nakasakit din sa atin because sometime in October, nagkaroon tayo ng inoculation of the PSG presidential na hindi pa
Yes.
dapat eh. Okay? The third one is the president's penchant for the Chinese vaccine. In fact, ang in-inject ng presidente sa kanya eh hindi pa registered with the FDA. So if the president was really supporting Sinovac na may EUA, bakit ang Secretary of Health injected a Sinopharm na hindi FDA registered? And that really dampened the spirits of most people kasi
Hmm.
ang dominant in the portfolio, 66% ng portfolio natin ay Sinovac and then
Yeah.
Astra. And then only a handful of Pfizer and Gamaleya. Yung overcrowding in Parañaque and Manila, yan ay subtle sign na ang Filipinos may brand preference. Kasi hindi naman tayo blind to it because we see Israel succeeding already. Diba?
Hmm.
They ditched the face mask, they opened the universities and the schools, and then the US right now, CDC has also declared that. So hindi
Hmm.
tayo pwedeng maloko kasi we see that,
Yeah.
we read that eh.
Correct.
So the
So you're saying,
hesitancy,
doctor, that there's a reason for people to be brand juicy.
of course, pumunta
Yeah.
ka lang sa restaurant, may bibigyan ka menu eh.
Hmm.
Pipiliin mo yun eh.
Correct.
Pumunta ka lang sa shoe store, ang may preference ka for your brand eh. How much more for a vaccine na i-inject mo sa sarili mo? When you buy shoes, siyempre gusto mo Nike or Adidas bago ka pumunta. When you go to a shirt shop, brand conscious ka eh kasi you want to get your money's worth eh. Now, buhay mo to eh.
Hmm.
Dito ka nakulong sa bahay and you know that the silver bullet is the vaccine eh. Kaya ang mga tao hesitant, particularly the A2, the senior citizen, and those with comorbid conditions. Kasi
Hmm.
i-inject nila sa buhay nila yan. Ang unang tanong niyan is it safe, doctor? Or should I wait for the the mRNA vaccines na doon nag-emanate yung vaccine hesitancy. Alam mo, tinan mo lahat yung orders ng private sector, I tell you. Those are either Pfizer, Moderna, or Astra ang orders nila. Kaya mababa ang vaccination rate. Kasi wala naman silang choice eh. They want to be safe because we are in a surge. But if we had a choice, let's not be, let's be transparent about it. If we had a choice, siyempre the best choice natin ay yung nakikita nating mataas ang efficacy rate on paper.
Mhm.
95% on Pfizer. Ang Moderna, 94.4%. Then
Yeah.
Gamaleya, kaya lang walang track record. And then yung Sinovac, you have a 50% to variable pa. Only 14 countries ang nagmamarket. Samantalang yung Pfizer, 150 countries all over the world. And then you have the Astra, the UK pa. So what I'm trying to say, I'm not, kaya ako nag-disclose ng aking um, um, association with Pfizer. Tapos na yun, 10 years na. But what I'm saying, may track record yun eh. Imagine
Mhm.
mo, penicillin sila ang World War II. They marketed the most successful product ever launched in history, the Lipitor, Norvas, all the franchise products eh. Tapos hindi tayo dun tumaya. We should put our money where our mouth is eh. Kaya I think protracted yung ating herd immunity economic recovery because we cannot accept the fact that we did not order the best vaccines na pwede tayo. Look at Israel. Look at UK right now. Look at US. And hindi naman tayo science-based country din.
Mhm.
We miss on the testings and contact tracings. Alam mo, kahit ang Australia, New Zealand, wala silang
Mhm.
bakuna, but they're okay. Vietnam, okay.
Mhm.
But
Mhm.
look at Singapore, in order nila. Now, si Joko Widodo is another story. Sinovac ang ginamit niya with Astra. But they are a very determined population. And kaya in 4 months time, dapa sila. So, ibig sabihin, it's just also execution. Kung Sinovac ang ginusto natin, but we should have executed well in terms of vaccination. And dun ang problema natin nagkakaroon. So the vaccination hesitancy, to summarize, is basically number one, is about safety, the brand preference, and number three is the lack of good execution in terms of the vaccination program.